This fall, Nan is headed to Palm Springs, California. Set aside the backdrop of desert skies, we're creating a space for neonatal nurses to take the stage, sharing knowledge, amplifying voices, and driving change. Join us from September 9th through 12th, 2025, to learn from experts, engage in powerful discussions, and take action to drive meaningful change in neonatal care. Registration opens April 24th, so mark your calendars now to take advantage of best value pricing. Head to nan.org/conference to learn more. Hello, and welcome to NANcast. I'm Jill, your host. As NICU nurses and providers, we dedicate our lives to caring for the most vulnerable patients, but ensuring the best outcomes goes beyond the bedside. Access to quality maternity and neonatal care is essential for improving outcomes for mothers and babies, yet across the country, disparities in care and access remain a critical issue. The March of Dimes has been at the forefront for advocating for maternal and infant health, using data-driven insights to drive change. In today's episode, we're partnering with the March of Dimes to explore the key findings from their latest reports, the challenges families face in the NICU, and the role of advocacy in shaping better care for our tiny patients. How can we, as NICU nurses and APRNs, better utilize the March of Dimes resources in our daily practice and in our interactions with families? To help us explore these topics, we're excited to have two incredible guests, Ashley Stoneburner and Dr. Amanda Williams from the March of Dimes, joining us to explore the critical issues affecting neonatal and maternal health, from preterm birth rates to gaps in maternity care access. Ashley Stoneburner is the Director of Applied Research and Analytics at March of Dimes. With over 14 years of experience in maternal child health, Ashley leads the team of epidemiologists comprising the Perinatal Data Center who produces the annual reports. Dr. Williams is the Interim Chief Medical Officer of March of Dimes, where she leads March of Dimes' mission team to advance efforts in research, advocacy, education, and programs that will prioritize the well-being of all moms and babies. We'll discuss how we all can play a role in ensuring every baby gets a strong, healthy start. Whether it's leveraging data, advocating for policy change, or strengthening NICU family support, the work of March of Dimes plays a vital role in neonatal and maternal health. Let's get right into it. Thank you for joining us today. The March of Dimes has been a leader in advocating for maternal and infant health, providing critical data and resources to drive change. To start, can you give us an overview of how the March of Dimes leverages research and advocacy through all of the tools and data that you provide?
So PeriStats is March of Dimes' comprehensive data website, and where clinicians and nurses can go online and learn about a lot of different maternal and infant health indicators. So what happens is our epidemiologists at March of Dimes collects data from a lot of different national organizations. We do all the analysis, we put it on our website, and anybody can go on there. It's open source. They can look at different indicators like preterm birth, infant mortality, maternal mortality, and a lot of other indicators. They can slice and dice it by race, ethnicity, by Medicaid status, to really understand the maternal and infant health disparities in their areas. They can look at trends to try to see if any interventions are making changes, and they can use it to guide their work.
So with your PeriStats, what insights have emerged from March of Dimes research and the statistics? Also, with the March of Dimes 2024 report card. I know everybody waits for the report card to come out and see where they land in their area. So can you give us some of the insights that you found with that?
Yeah, so on our 2024 report card, which is released every year in November, we essentially get all the new data on infant births and infant deaths, maternal mortality, and other birth indicators. And we found this past year that the U.S. got a D+ grade in preterm birth. And so that essentially means that we're failing our moms and babies in ensuring good birth outcomes. We also, in the latest report card, saw that there's, in the first time in 2 decades, an increase in infant mortality. So in general, infant mortality has been decreasing, but this past year we saw the first increase in decades. So that tells us that we definitely have some work to do. We also saw other indicators like cesarean sections increasing and prenatal care adequacy declining, which means that we have a lot of work to do.
So the maternity care deserts report is showing us that there are some gaps in access, resulting in impact not only on our families, but the outcomes of our babies. What policy changes can we do to help improve access and outcomes, particularly in those maternity care deserts?
Well, thanks for the question, Jill. And let me start out by defining what a maternity care desert is. So that is a county. So that's a county level designation inside of a state where there is no hospital with a labor and delivery unit, no licensed birth center, no obstetrician, and no midwife. So basically, no place to have your baby and no trained person to take care of you during that birth. So this is a pretty stark situation for the women who live in those counties. That said, 35%, that's over a third of counties in the United States are designated as maternity care deserts. And there are 2.3 million women who live in these counties. I mean, young families don't say, oh, this is a nice place to start a family. I think I'll move to this county. And then are there labor and delivery units there? People assume that they exist. And yet, far too often, that's not the case. So the question then is, what can be done? What kinds of solutions are there to improve access? And one that's very top of mind right now because of the budget cuts being proposed is expansion of Medicaid and improvements to Medicaid reimbursements. One of the leading reasons why hospitals are closing is because the reimbursement of the hospitals is so poor when patients are insured through Medicaid. Also, we know that Medicaid provides insurance for prenatal and postpartum care, and there's been a huge uptake over the last couple of years of states extending that Medicaid benefit through the whole year postpartum. So that's a key piece of policy that March of Dimes is focused on. Also, of course, expanding midwifery access could help with access to care. Supporting birth centers, and they're usually licensed through the state, so working with states to think about what some of those licensure barriers are. 70% of all birth centers are in just 10 states. So there's huge opportunity for birth center expansion. So these areas where access to care is really being threatened are some of the highest priority areas for our policy and advocacy work at March of Dimes.
So you mentioned Medicaid, and we all know there's ongoing discussions now around healthcare policy and potential changes for Medicaid. And there's a lot of growing concerns around how these shifts could have impact our NICU care. So given the current political climate, what are some of the biggest challenges and potential changes to Medicaid that providers and families should be aware of? And how does that affect access to this critical care for our NICU babies?
So a lot of folks don't realize that almost half of the births, like 1 out of 2 people in the United States who are having babies are insured through Medicaid. So that's a huge amount of the population, and it's even more so in rural areas and places where there has been chronic disinvestment. That number increases in the NICU. And so let's double click on that for a minute. So when you have NICU babies, those are usually patients who have high-risk pregnancies. And we know that social drivers of health also are driving poor pregnancy outcomes. So you're more likely to have a patient who is insured through Medicaid. This then becomes even a bigger deal if you have a long NICU stay, because most commercial insurance runs out if you have a baby in the NICU for 2 or 3 months. You go to your lifetime max of your commercial insurance, and then Medicaid is the insurer of last resort. And then Medicaid can even end up being the insurance for very wealthy people because they've maxed out their commercial insurance benefit. So if you are a NICU nurse or a neonatologist or someone who works in a NICU, you should be very concerned about some of the proposed cuts to Medicaid because it truly impacts your patient's ability to get care.
That was wonderful to shed some light into that. Bedside nurses, some providers, we are just so laser focused on the care of our baby at that time and don't think about the insurance aspect and aren't really putting that into how we're caring for the babies. And that's a struggle that parents are having that we're not privy to and we might not realize. And the 50%, that's astounding amount of people that are requiring Medicaid. So I think this issue is really important, and I'm glad that we have you here to explain to us all the importance of advocacy in this, especially in this climate right now that we are dealing with politically.
And the thing is that, yes, some might say this is a politically charged issue, but I like to frame it not as a partisan issue, but about a care issue, right? We're clinicians. We care and provide support in our clinical expertise for these moms and babies. And so it's not about being from one party or another. It's about taking care of our patients. And our patients have to have insurance in order to get their care. Our hospitals have to be reimbursed at a reasonable rate in order to have their doors open. Everybody knows that NICU care is some of the most expensive care in the hospital. And so if we're going to be good financial stewards of the hospitals where we work, we should be advocating for Medicaid.
And I just want to add one additional point that we are worried about when it comes to Medicaid cuts is that moms that have babies in the NICU are at increased risk of having some mental health issues. And mental health is one of the leading causes of maternal mortality. So when those moms lose that postpartum coverage, that Medicaid postpartum coverage through 1 year postpartum, they are at higher risk of mental health issues and not being treated for them, which could lead to maternal mortality.
Ashley, I'm glad that you started talking about our moms and our families because March of Dimes does so much more than just provide the resources that we need as clinicians, but also help the parents navigate their NICU journey and help to support families, which is a very important aspect. Can you tell us what March of Dimes does to help support the families and kind of expand on what you were talking about with the maternal health and aspects like that?
So one of our featured programs inside of March of Dimes is the NICU Family Support Program. We are in over 70 NICUs across the country, and we reach 52,000 families. And what we're doing there, in addition to education, is emotional support, mental health screening, activities. We do bedside activities such as keepsakes, milestone recognition. We do meals for families, meals for staff. We do professional education that's like trauma-informed care, perinatal loss. And then we even have an app called the Compass app that you can download off the App Store that's specific to NICU families. It gives you tools for tracking weight, tracking your breastfeeding, info about kangaroo care, warning signs for postpartum. So all of these things are part of this sort of wraparound suite that we do for support for the families and for the providers inside of the NICU. One additional piece that we started just a couple years ago and are looking to expand is integrating Mammha, which is a behavioral health platform in some of our NICU family support programs. So what this is an Edinburgh postpartum depression screening tool that's done inside of the NICU. And then the information goes directly to a care coordinator who then makes referrals for mental health support. And then we have March of Dimes support groups for both patients with depression, for fathers, for patients who just are in the NICU and could use a little extra support, and then in extreme cases, get to emergency mental health care. I was just actually 2 days ago in the Inova Fairfax NICU when visiting in Washington, D.C., which is one of our NICU Family Support sites that has the Mammha behavioral health platform. And it's amazing to see the way that this is integrated. The little QR code can be scanned right at the bedside. They have them in the pumping room, at the bedside, in the family break room, so that families can get that support right away. And then they get text messages that encourage them along their NICU stay. And they even actually picked up a dad that was having suicidal ideation because he was feeling so overwhelmed that there wasn't anything he could do to help his wife and family. So we can't forget about the partners because they're having a hard time too. And one of the nice things about this Mammha platform that's integrated into our NICU family support at some of the sites is that it's available to both parents.
I have seen firsthand the impact of the NICU Family Support Program in my unit. It's amazing how the families come together and they can discuss their challenges with people that understand and people that get them. And the bonds that they have is really neat to see. And I know everybody gets excited to see the calendar of events and what's going to happen that month. And it's just nice for them to have a little break and some normalcy to meet with other parents, make a craft, just get their feelings out. It's an amazing program. And also the mental health aspect. I know some NICUs might not have access. Their parents might not have access to mental health professionals. They get discharged from the postpartum floor, and then we kind of forget about the mental health aspect. So the fact that the March of Dimes is providing that and that partnership is so helpful for these families where we might miss things that this program's able to pick up.
Absolutely. And there's so much goodwill that comes out of it and relationship building that you referred to, which is where we're super excited about the support groups. So even if there isn't sort of an internal support group at that hospital, March of Dimes has virtual support groups for these NICU parents also. And, we just learned just last week, actually, the data was released that the number of babies going to the NICU is actually increasing. So this last set of data that was released was 2016 to 2023. The percentage of infants admitted to the NICU has increased by 13%. Even with all of our technological advancements, the number of babies going to the NICU is increasing. So we need to make sure that they have the support that they need when they get there. And even if it's just, at March of Dimes, we love holidays, we love making costumes and decorating onesies and doing all of these fun things to make the families feel good. And we're coupling that with education and with emotional support and support for staff. So it really, NICU Family Support's amazing. It really is a very comprehensive program.
So 1 in 10 babies were admitted to the NICU in 2023. And like Dr. Williams says, that's a 13% increase since 2016. And we're also seeing increases in admission for full-term infants, for infants that are born to moms of any age, for infants that are born post-term, preterm. It's increasing all across the board. So we really got to pay attention to why that's happening. See how we can decrease the percent of infants admitted to the NICU while also obviously maintaining survivability, but also support those moms and babies and families while they're in the NICU.
Just to follow up, Ashley, this is one of the beautiful things about PeriStats. And as there has been, and it appears there will continue to be decreases in funding going into research, private organizations like our own become increasingly important. And given that PeriStats is an open source, so anybody can go on there. If you're in nursing school, if you're in medical school, if you're doing a project for your staff nurse 4, if you are in public health school, like anyone can go. If you're a policymaker, anyone can go in there and look at their state, or look at the country. They can segment the data. I mean, what do you like the most, Ashley, about PeriStats? Because you're the queen of PeriStats.
That's right. So I love hearing from so many people about how they've used PeriStats, how they use our reports, what they do with our report cards, what they do with our maternity care desert designations. And you can find all of that on PeriStats. And the team that I am with does all the analysis for you. So it really increases efficiencies. People use it when they're grant writing because to do that analysis, to do some of these analysis at a local level, at a national level, to have comparison groups, it's really not feasible for a lot of people. And so PeriStats really provides that resource to speed things up and to keep funding our initiatives and our programs, and just provides the data backbone that a lot of people needs. And I've even had requests for t-shirts to be made that say PeriStats. We have our own logo. We're really trying to increase awareness of this great tool, especially as funding decreases in local and state health departments. They may no longer have data analyst positions. Another cool thing about PeriStats is it has all of our reports that we ever produce at March of Dimes. So it's a really good place to find the latest maternity care desert report, the latest report cards. We even have literature that is updated and linked. So it not necessarily publications that we have produced, but maternal and infant health literature, a hub that people can go to find relevant manuscripts that have been published too.
So since PeriStats is so popular, can you tell us one of the projects that was created using the PeriStats data?
Yeah, so I was just at the AMCHIP conference last week. That is the Association of Maternal and Child Health Programs. And there are a lot of people throughout the United States that come there to learn about different health programs and children with special health care needs and infants and families. And so one of the attendees had visited me at my poster that I was presenting, and the poster was on maternity care deserts, and she had told me that they used our data. They use it to inform their participation in their maternal mortality review committee. So one of the requirements of the people that sit on those committees is that they are from a maternity care desert, so that they can help inform how to address the risk of people who live in areas with low resources. So I thought that was a really cool way to use our data. Obviously, there's people that aren't living in maternity care deserts on their review committees, but I thought that was a really innovative way. We hear a lot of these things when we're attending conferences and we're out meeting people that use our data. There was a state, I think it was South Dakota, they overlaid our maternity care desert data with their home visiting programs, and they targeted areas where home visitation could be beneficial. So areas that were maternity care deserts, and they actually suggested new programs in those deserts.
That's amazing to be able to get that data, see it, and then take action right away. And can be an easy fix to kind of bridge that gap with those desert areas.
Yeah, even if the home visitation program is just using telehealth, because sometimes You can't take a nurse from a metropolitan area or another home visitor and serve people in maternity care deserts. So that's why telehealth is really important too, because it's a way to increase access for people in areas that may not be able to reach.
Which is another area where March of Dimes has put a lot of energy in advocacy, is around telehealth. Because we're so tuned into these maternity care deserts. One of the ways we like to think about it is either we bring the care to the people or we bring the people to the care. And so we've got telehealth, we've got programs that give rides to people to get to their appointments. And then we also have our mom baby mobile health clinics. We have 6 of them around the country, which are these giant purple coach buses that go into communities that have been underserved. And there is a whole clinic inside of the bus where people can get prenatal and postpartum care, and then new baby vaccines also.
So as providers or NICU nurses, is there a way to find the schedule for where the bus is going to be if they want to make sure that our parents and our families are getting the care they need?
Sure. If you go on marchofdimes.org, which is, of course, our website, there is a whole section about our work, and our buses are in different states. And you can find out if there is a bus in your state or in your area. And if there's not, it's something that you can talk to your hospital administration about fundraising for. Or oftentimes what we do is we have our local March of Dimes teams that are bringing together donors, and then we partner with the health system that does the staffing. And so we do the physical item, the physical bus and driver, and then, make it all fancy on the inside. We have tons of education, and then the health system provides the clinicians. So it's a really great partnership that we have in many places around the country.
So we talked all about the resources that we have for clinicians. We talked about the resources that are available for our families. So how can nurses and APRNs and other NICU providers take all that information and create change? So what are ways that we can get into advocacy efforts to support our families and our babies?
So one really fun way that you could increase your advocacy efforts is to join us on some of our events that we have. And one of them is called March for Change. And this is when we kind of get a ticket into the state capitals, into the national capital in Washington, D.C. And these events happen in the spring. And it's a great chance for people to go talk to their legislators, to talk about women's health, to talk about healthcare access and how to support healthy moms and babies, and to invest in research. And it really, I know it's been such a powerful event for those who have gone to it, to see our work in action and to see the people that are making our laws and to be able to communicate why it's so important. Our March for Change in Washington, D.C. has already happened this year, but there are some more events in the spring. So you can check our website to see which ones are coming up, or you can just save all your energy for next year and just know that these events happen in the spring, and that can be your time in 2026.
There's also the grassroots advocacy possibility. So if you go onto the marchofdimes.org and go into the advocacy section, you can sign up for the March for Change in your area, or you can sign up to be a grassroots advocate. What that means is that if there's a bill that's coming up about, let's say, sudden infant death review committees, you can then add your signature to the bill or to a letter that's going to your legislator in your area. So they'll take your information and match it with whoever the local legislator is, and then when maternal infant health issues come up, then you can activate and send a letter.
That's great. So then you can be on top of what's going on, because I think that's a problem. We don't know where to start and where can I find this information, what bills are coming up that's going to directly affect our patients. So to be able to go to the March of Dimes site, put in your information, then you'll be aware of what's happening and know how you can provide change. I know NAN also has a health policy and advocacy committee that does also post different bills and legislation that's coming up as well. So there are ways to find it. You just have to know where to look.
The other big activity that we do is called March for Babies. And March for Babies is the oldest fundraising walk in the United States. And the idea is that we are bringing communities together to connect, to honor, and support families, and to help raise money for all of this work that March of Dimes does. We advocate, we educate, we innovate, and we collaborate. So that we talked about our advocacy, you guys know about our education, and the innovation side, we have our prematurity research center. So we're funding 5 research centers around the country. We are also giving individual research awards, and we're investing in young companies that are innovating in maternal and infant health. And then on the collaboration side, we're doing local projects. I spoke about the cars, we're doing blood pressure cuffs, training doulas. So there are lots of local projects that are going on, and we're part of collaboratives. We're really conveners. We bring together people who are interested in this area. And we are not dependent on federal funding. As I said before, this is almost entirely private individual donors. So you can make your own donor page. Lots of NICUs have teams because we who work there have been impacted. We see what happens to these families. In programs like NICU Family Support, like the Mammha mental health platform, all of this work that we do does take donation. So if somebody wants to give to an organization that works across the maternal infant health ecosystem to drive the results that we want, which is healthy moms and babies, then March of Dimes is a really good place to put your energy. So get your team together. We have scores of March for Babies events all over the country. And if you go to March for Babies, you can put in your zip code and find where's the march that's closest to you. Our moms and babies need us. We do this work every day because we care about these teeny tiny humans and the families that they're going into. And we're living in a time where this work is not being prioritized and resourced. The March of Dimes is the leading organization for maternal infant health, and we cannot do it without your support. So thank you so much for the work that you're doing inside of the NICU, and please join us as we work across this maternal infant health ecosystem to support our moms and our babies and families.
Thank you so much, Dr. Williams and Ashley, for joining us today and sharing the amazing work that March of Dimes is doing every day to help our babies and our families. And I am sure you have inspired us all to become advocates for our families and babies. So thank you. Make sure you never miss an episode of NANcast by subscribing now. This podcast is made possible by listeners like you. Thanks for your support and letting us into your ears. Have a great day.